Honestly, Mr. Chairman, I feel very, very good about the work that the university has done and that this team has done and the direction that we are heading going into next semester. So I will now turn it over to Dr. Jones to go into more detail for our spring plans.
Thank you very much, Mr. President, and thank you for advancing the slide to our dashboard. And I encourage everyone to keep track of our dashboard. This is last Friday's version. It's updated twice a week, and we're getting ready to do a little modification of this, and I think by next week it'll include more data. The important graph is really in the upper right-hand side, and that's the percent of the incidence of our tests that are positive, and they are running generally between 1 and 1.5%, and they've been in this range for over a month. That's very, very impressive. And you know, if you get into the prevalence rate of what's actually in the population, not just people who feel sick, but the average in the population, it's actually lower than that. Because of this long stretch of providing low infection rates, much lower than the state, much lower than the nation, we have developed a lot of trust among our employees, our parents, and our students about having an environment where we can operate safely, and as the president pointed out, find new ways to start increasing our face-to-face learning. On the bottom left-hand side, you take a look at one of those circles that you've probably been paying attention to. That we're now over 130,000 logged tests. The percent positive is declining because we've had such a long period of time of low incidence. We're beginning to overwhelm all those old positives that we had during the spikes when we started this process. There's a new graph in the middle. It's a circle with a blue and gray. And that is a way for us to show that a lot of those positives that we logged actually occurred before or right up when students were arriving in the pre-arrival testing. Only 43.9% of all the positives actually happened after we had them on our campus, and we began aggressively driving towards our strategy of isolating people when they were infected. And in the far right, you can see we are down to 12 individuals as of last Friday who were in isolation and quarantine. We definitely made the right decision not to have face-to-face learning after Thanksgiving, because right about now, that number could easily be 200 to 300, and we'd have people lingering right up into the holidays. That said, we're very excited about opening in spring with a new strategy and more face-to-face learning. And let's get started on that with the next slide. Here is our testing strategy. As the president said, it's going to be similar to how we opened up in fall with pre-arrival and move-in testing. For all students who are on campus, they have to have 2 tests, one in the week prior to moving in, and then in the few days after they moved in and before classes start on January 6th, they have to take another test. And they have to log 2 negatives here before they will have access to classrooms and the buildings. For our off-campus students and employees, including myself, the president, everybody, we will need to log a negative PCR test between December 28th and when we want to access a building in spring semester. So we're getting everyone off to a fresh start and not having people who are positives that we know about walking around on campus and infecting people. We're also allowing people who have had a positive test 90 days prior to this pre-arrival and immediate testing in spring to have a pass. They're exempted from this pre-arrival testing. However, beginning January 11th, everybody goes back into the pool, and we'll be testing everyone once a week. We're getting right back into our aggressive testing strategy. And of course, at any time, should things change, we will adjust our strategies appropriately as we have done in fall. It's really important what the president pointed out. This new CLIA lab, which is a federally certified lab for collecting human specimens and doing diagnostic testing, that has opened up the door for us to be able to do this kind of aggressive pre-arrival testing. All right, if we can move to the next slide. Testing's one thing, but what we got to do is our mission. And we are focused on a return to normalcy, to coin a phrase that's crafted by the chairman of the board. And we think that this is a great approach, and we're going to get far closer to normalcy in spring semester. Right now, we're in course registration, and that goes all the way up to January 12th, which is the last day that you can add a course. Right at the moment, we're seeing an uptick in requests. That's kind of encouraging about spring enrollment, but we really won't know those numbers till January 12th, and we can get a reasonable estimate of how many students are enrolled. We have added a new kind of teaching. Prior to the spring semester and this fall semester, we had two options for students: fully online, or what we call blended, which means we could have some students in a class attend one class period in the week, but they would have to be online the rest of the week. That didn't work out too well here or any university. It was not a strategy that is comfortable for teaching and learning for students or for faculty. In fact, they prefer to be either fully online or fully face-to-face. But because of the confidence that we've developed among our students, parents, and our faculty, that we can manage our COVID environment, we were able to take a look at our classroom space, and with a number of students being fully online and a number of courses have to be fully online because of social distancing, that actually opens up a lot of classroom inventory, which means some courses could have all of their students meet every class period, all week long, all semester long. And that's what we call these traditional courses. A new invention is actually getting back to normal. And you can see the number of courses that we have now. About 31% of them are all traditional. And then the blended, which also offers in-person interactions, not to the same level, is going to be about 26%. The faculty are excited about this. When we developed this, they requested in large numbers. They wanted to try to make this happen because they feel like they're missing that experience in the classroom. But at the same time, I got to point out, there are a lot of faculty and students in courses where the quality of the online learning is sufficient now for people to feel that that's a real convenience. And having some online courses and some face-to-face is sustaining a high level of quality for most of our students, and in their view and their opinion. And for those who struggle in the online learning, we have enormous efforts in our advising ranks to pay attention, to reach out, to provide help and support. So we're feeling pretty good about that return to normalcy. Right now, we still allow students who have health concerns to request to be fully online. That number stands at about 1,293 that are approved for that in spring semester as of today. Last fall, that number was 3,803. Will probably be somewhere between those two numbers for spring semester. At the moment, we realize we're going to have a lot more students on our campus, and they will be hanging around campus in between courses. They need spaces to sit down, use EduRoam to get to the internet, and either take one of their online courses while they're on campus or to study while they're on campus. So we have a very, very large effort underway to provide all that space, socially distanced, safe, for our students for spring semester.
And Ms. Provost, let me just point out one thing based on the table that you are showing us. The majority of our courses, more than 50%, will either be fully in person or at least blended in person in the spring.
That's correct. And many of our peer institutions are of one extreme or another. They did not do this kind of innovation, and they have very low levels of in-person teaching as a result. Or they asked all of their faculty that unless you have health reasons, you must be in the classroom. And what happened in those institutions? They lost significant trust and put a wedge between the students and the faculty. And that is not following Clemson's values of respect, integrity, and honesty. And we feel very proud of the relationship and trust and collaboration we have between our faculty and our administration and our students. And the students are engaged in helping us with many of these strategies, and as are the faculty. That level of trust is what's going to sustain the quality and the Clemson environment the way we know it. And I'm very, very proud of our faculty for their work and engagement in trying to make our spring semester a lot closer to normal.
Thank you, Mr. Provost, and also thank you for pointing out the students' involvement in helping craft that model. Thank you.
Bob, Jim, thank you very much. Do we have any questions for President Clements or Provost Jones from the board?
Mr. Chairman, J.J. Britton. Bob, I'm just wondering, you said you're going to retest everyone starting in January when they return. I assume you have concerns about how long immunity would have lasted for people who had already tested positive. So once you start testing again, will you then remove positives from the pool for retesting?
Yeah, yes, I think we will probably be doing that. So that's the sentiment currently, but we are, like you, watching very carefully about what the data are showing us on immunity. And if we have any uncertainty at all, we will not take risks, and we'll ask people to take a test. Taking a test in our current environment is so simple, so easy. It's almost enjoyable. You get a little walk, a little exercise in, walk right out. And, it costs us very little. And the peace and the knowledge that we're doing the best that we can to be safe is well worth it.
And Dr. Britton, I'll add, we've got just brilliant faculty who are advising us on the strategies, and they've guided us so very well. We will continue to trust their expertise.
Good. Thank you.
Any other questions from the board? Well, Jim, Bob, on behalf of the board, I'd really like to commend the entire administration, the faculty, the staff, for their tremendous efforts this fall. And Bob, I really want to applaud you for focusing on a return to the classroom in the spring by increasing the number of in-person opportunities for our students. I know that's what the board wants. I know that's what the students and parents want, and I know that's what you want. Because the required social distancing in the classrooms will not be back to normal right away, but we're clearly going to be off to a great start. And as the vaccine rolls out and the impacts of the virus diminish, I encourage you to continue to look for safe ways to increase the in-person opportunities for our student. And through this COVID journey, is if we look back to the spring and the challenges that were before us, there were so many. They were financial, they were demand driven. We were concerned about the health of the faculty, the health of the students, and all of those things. And Jim, I don't think we can overstate how wonderfully well your team has navigated this circumstance. To see the dashboard and to see that only 43% of the positives occurred since we've gone back to in-person learning, I think is incredible. And minuscule percent positive rate is incredibly encouraging. So